So my wife was just asking me about Matthew Perry, and her question was, did he relapse? And she showed me the tox report. And so they basically determined his death to be from 4 things: drowning, coronary artery disease, ketamine in his system, and buprenorphine. And it took me a little bit to explain to her, but then I thought, oh, maybe everybody's interested in this. So here's the rollout. Buprenorphine is what we call an agonist-antagonist. It's an opioid-type medication, but it also blocks other opioids like heroin, fentanyl, morphine, hydromorphone, oxycodone. And so it basically can help addicts to kind of stop their craving, but then also make it so that if they were to relapse, they don't actually feel the effects of the medication. And so that was in his system. That's pretty normal for somebody who's like an opioid addict. So that's normal. Ketamine was in his system. He was on ketamine infusions, and this is something that's prescribed to people for depression. There's also a few other pain indications. It's hard to know if he was prescribed that medication. I mean, his levels were pretty high.
Well, unfortunately, the autopsy results of the famous actor Matthew Perry has been released. And guys, as you all know, Matthew Perry unfortunately passed at the age of 54. And finally, it looks like the autopsy and what really happened backstage or behind closed doors has been unraveled. Well, you have to stick and stay to listen to exactly what caused his demise and what people also have been talking about. Now, there have been some mystery behind this death already, and I'm happy that finally the autopsy has come out, but let's get into it very shortly. But just before we go into that, please do also subscribe to our platform. It's very necessary. Your thoughts and comments, as usual, will be appreciated inside the comment section. Join today's episode as usual. Let's get interactive. Now, Matthew Perry apparently, as we all do know, died from the acute effect of the anesthetics, or ketamine. Now, according to the result of the autopsy on the 54-year-old French actor released on Friday, the Los Angeles County Department of Medical Examiner said that the autopsy reports that Perry also drowned in the heated end of the pool. Now, but this was a secondary factor in his October 28th death. Now, we brought to report about it. Now, people close to Perry told investigators that he was undergoing ketamine infusion therapy, an experimental treatment used to treat depression and anxiety. But the medical examiner said that the levels of ketamine in Perry's body were in the range used for general anesthesia during surgery. And that's apparently last treatment about, weeks earlier. And unfortunately, it wouldn't apparently explain to those levels. Now, the drugs is typically metabolized in the matter of hours. The report apparently says that coronary artery disease and buffering, which is apparently used to treat opioid use disorder, also contributed to this. Now, the amount of ketamine detected would be enough to make him lose consciousness and lose his posture and his ability to keep himself above the water, said Dr. Andrew Solbach, who apparently is a medical toxicologist with Johns Hopkins Medicine, who also reviewed the autopsy report at the request of the Associated Press. Now, using sedative drugs in a pool or hot tube, especially when you're alone, is extremely risky and sadly. Here is the fatal, incident that did happen. Said, the doctor who apparently noted both caffeine and buffering can apparently was the reason that caused. Now, Perry apparently was declared dead after being found unresponsive. We all do know at his home in the Pacific area of his Los Angeles house. Now, investigators, I beg your pardon, performed the autopsy following day, and of course, the actor was pronounced dead. Unfortunately, people had also suggested that because, well, he has already come out to say in the past that he had reportedly been in drugs and was battling, trying to extricate himself from drugs, and so basically he died as a result of drugs. But here we are, and the autopsy is saying that Perry apparently did not die basically as a result of just mere drugs alone. But unfortunately, the postmortem blood tests show that high levels of ketamine in his system led to the rise of his blood pressure, and of course in his heart rate, and doubt his impulse in breath. Now, I remember very well that not just people on the comment section after this news broke were very sentimental about this. The friends, cast or the crew also took to social media, and I think one person was speaking about it, and that was Jennifer Aniston. Not just them alone, or just her alone. A lot of people probably took to social media to express their condolences and sympathies. Well, guys, as you all know, he died at age 54. May you still rest in peace, and of course, we extend our condolences to the family. Well, let's listen to some of the conversations about this and what people have been eulogizing or would want to also share after the demise of the legendary actor Matthew Perry.
So my wife was just asking me about Matthew Perry, and her question was, did he relapse? And she showed me the tox report, and so they basically determined his death to be from 4 things: drowning, coronary artery disease, ketamine in his system, and buprenorphine. And it took me a little bit to explain to her, but then I thought, oh, maybe everybody's interested in this. So here's the rollout. Buprenorphine is what we call an agonist-antagonist. It's an opioid-type medication, but it also blocks other opioids like heroin, fentanyl, morphine, hydromorphone, oxycodone. And so it basically can help addicts to kind of stop their craving, but then also make it so that if they were to relapse, they don't actually feel the effects of the medication. And so that was in his system. That's pretty normal for somebody who's like an opioid addict. So that's normal. Ketamine was in his system. He was on ketamine infusions, and this is something that's prescribed to people for depression. There's also a few other pain indications. It's hard to know if he was prescribed that medication. I mean, his levels were pretty high, so likely it wasn't, but he was on ketamine therapy that was prescribed to him, and this contributed to his death according to the coroner's report. Now, one way that coronary artery disease and drowning can contribute is ketamine. When we give it in the operating room and anywhere, it can kind of stimulate your heart. And so one thing it can cause is tachycardia. Tachycardia can cause your heart to use a tremendous amount of oxygen. So if you have coronary artery disease where your blood flow to your heart isn't that good, if you really raise somebody's heart rate, it can cause them to have ischemia of the heart, and they can end up having an MI. So likely, based on this report, he probably took ketamine, he got probably got tachycardic, probably got ischemic in the heart, probably had a heart attack, passed out, and then drowned. And so that's likely.
Hi, everyone. While writing my memoir, Friends, Lovers, and the Big Terrible Thing, I had a chance to reflect back on some of the most important, for better or for worse, moments and experiences in my life. It was a really personal and sometimes challenging journey, and I'm looking forward to sharing my story with all of you. I've been asked to give any general life advice, which is kind of funny that I've been asked to do that. I want people to understand that they're not alone, that there are other people feeling exactly the way they're feeling, that their behavior is not insane, that they have a disease, and it's not their fault. There's a very famous kind of line that people don't change. I happen to know that people do change, and I see that every day. I see people getting better. I see the lights in their eyes come on, and they get through the terrible part of addiction and the detox, and they're able to live a normal life as long as they do a certain amount of work every day. If you'd like to hear more about my story and how I came to learn these tough lessons, I hope you'll pick up Friends, Lovers, and the Big Terrible Thing. You just go, you pick it up like this, and then you open it and you read it. That's all you have to do.